Can coronary blockage be reversed? It is a common question asked by many patients that they have identified to have a coronary blockage either by a CT angiogram or coronary angiogram, and they come and say like, I want to remove the block or I want to dissolve the block. And some patients have been offered by some physicians to say, but injecting certain chemicals can able to dissolve or completely disintegrate the clot and remove it. And let me be very clear, we can able to arrest the progression of your blockage. In the sense, there are medical management which we can put on you so that your block might not progress, but there is nothing we can completely do to reverse. The only thing that study which showed that it can able to reverse is, it's called an asteroid trial. In that also, if you take that cholesterol medication, we call it as statin, continuously for 2 years at the dosage of around 40 milligram, and rosuvastatin, it's a statin drug which they have been used in the trial. We have shown there is around a 7% regression in 2 years. That is a maximum which can achieve in Medican by reducing the block size, and there is no treatment can actually completely remove the blockage. In fact, most of the cardiac treatment we are providing is to what we call as a plaque stabilization. So we put you on a statin so that your block remains there and would not get dissolved or break. And once the clot break, it's a very dangerous situation we call as thrombus and causes a heart attack. And this is what is a fact. And many times when somebody offers you that they can able to dissolve and they can disintegrate the block, it cannot happen. And even if they unsuccessfully did that, actually they are converting you from a stable patient into a patient with a heart attack. Because once this block is disrupted, the surface is disrupted, then what happens is the thrombus or the clot is formed there, and once the clot forms, it can dislodge, and we call it as a thrombus. Once it dislodges, it can move again your coronary artery and get blocked when the coronary artery become a small diameter and causes a heart attack. So what as a patient you should understand is there is no magic remedy to reduce your block or dissolve your block, and all we can be able to make is stabilize your heart and make sure your block does not grow any further.